Hello everyone, I am Giovanna Covarrubias and the career that I will be focusing on is Director of Family Health Services. An overview of a Director of Family Health Services is that they seek to address conditions in which the maternal, child, adolescent, and young adult populations and their families can be healthy by assessing community health concerns. They also act as upper-level healthcare administrators who manage care operations and control departments and provide direct support to families according to the Bureau of Labor Statistics. Their main goal is to empower individuals to adopt healthy lifestyles and make sure that their well-being is being taken care of and that they are providing them with the best needs that they need. And there are three specialties to a health service director, and that is generalist, pediatrics, and quality. The job responsibilities of a director of family health services is that they are in charge of overseeing the daily operations of a public health center, which they manage facilities such as finances and human resources. They also communicate with the families of the residents regarding healthcare needs and provide education and support to the residents and families. And what their main goal is to provide families with affordable healthcare and give them their knowledge of what they know of health education and the healthcare plans and what they can do to better their health lifestyles and to better their well-being. So as a generalist, director of family health services. They work for facilities that provide treatment services to adults, children, adolescents, and the elderly. They also direct daily operations related to admissions, patient services, billing operations, and continuous improvement programs. Pediatrics work with other healthcare specialists and family health service directors to coordinate and monitor services, and they are accountable for the successful financial management of the pediatric program, which most likely will include various clinics and locations. And lastly, the quality improvement, they work directly for chief executive officers and boards of directors. The direction of the organization's risk, quality, and improvement management programs, and their goal is to inspect facilities and review documentation. They also ensure facilities that comply with the state and federal regulations and hospital policies because they need to make sure that they are providing families with the right terms of policies and health education. The job setting of a director of family health services is that they work in a public or private family health centers. They spend most of a large portion of their day in an office setting and need to communicate between various members within an organization. Some directors have some contact with the clinical portion of the center, healthcare facilities, hospitals, nursing homes, and group medical practices, but this all mainly depends on what your career is focusing on because like I said, there is different specialties as a director of family health services, so it just depends on your career interests and your job title that you. The education and experience needed for this field is your bachelor's, master's, and doctoral degree. They recommend that people major in public health, public administration, long-term care administration, health science, or business administration. And you must have several years of experience, either in healthcare or nursing if you're able to. Most directors of family health services professionals maintain certification through American College of Healthcare Executives, and this is where most health service directors get their certification. And you must also maintain licensure such as an RN license and have the demonstrated ability to execute effective programs that meet needs of staff, patients, and family. The core competencies and skills that are seen and needed in this field are Area 2, Plan Health Education and Promotion. And the way it is seen is that directors of family health services develop goals and objectives for families or individuals in their health aspect of their lives. They also provide healthcare plans for families that are within their budgets and is affordable and is not too overpriced for the family and it's something that they can afford. And also Area 5, which administer and manage health education promotion, which they manage financial resources for health education and promotion programs. They develop financial plans for families and they manage the family's health data, and they can go back. You can be under a director of family health services for as long as you're little and they will have your data and you can go back and see how your health is doing. And Area 7, which communicate, promote, and advocate for health education promotion and the profession. And this is seen because they organize community efforts to embrace health promotion and wellness and core values. And they also use the community in order to embrace health promotion and wellness core values into families and individuals to better their well-being. The employment outlook for this field is between 2018 and 2028. The career is expected to grow 18% and produce 71,600 job opportunities across the U.S. Employment is expected to grow by about 20% over the next 10 years, which is much faster growth than average for all occupations between 2016 and 2020. The career path many of these people in this field acquire is one, obtain a bachelor's degree in health services administration, public administration, or business administration. Many employers prefer job candidates who have a master's degree. And then two, you need experience. And then three, your license. For most places of employment, health services administrations don't have to meet any licensing requirements, but you must also complete a state approved training program and take continuing education course. The reason I selected this position was because I want to work in that community health environment, and I want to be able to use my knowledge of health education and promotion and incorporating it into other families and individuals' life and how they can adopt healthy lifestyles through this information and how they could better their well-being, and also provide them with good healthcare plans with that stays within their budget range. And these are my references, and that is the end of my presentation. Thank you.